Thank you, everyone. Good morning. My name's Chris Oxenford from the WHO office based in Lyon in France. It's an outposted office of headquarters, but physically based in France, and our main area of interest is in building capacity in countries to meet their obligations under the international health regulations to report events of public health significance. And I'll mention that a little bit later. But just to give you a little bit of context, international public health, that is what WHO is all about, it's actually been around since the middle of the 19th century. And it really started with the International Sanitary Conference in Paris. And this was designed to work out what to do about outbreaks of cholera that were being introduced into Europe at the time. The challenge, or one of the big challenges, was that they didn't actually know what caused cholera or how it was spread, but they knew that they had to do something. So the initial activities were actually a little bit limited owing to lack of knowledge. But over the decades, as our understanding of these diseases increased, they realised that there were specific measures that they could take. And so towards the end of the 19th century, that we had some conventions on the control of cholera and a number of other diseases. And then early in the 20th century, we had institutions set up in a number of around the world. And in 1902, we had the International Sanitary Bureau in the Americas. And this organisation still exists. It's now called the Pan-American Health Organization, and it serves as the regional office for WHO in the Americas. So that's the oldest public health organisation in the world. And then in Europe, we had an organisation established there in 1907. And after the First World War, the League of Nations was set up, and it established a health organisation. And then after the Second World War, and the United Nations was established, and it was agreed very early on that they needed an international public health organisation. And so there were a couple of years of discussion, and eventually a constitution was set up, and WHO came into being in around 1948. The priorities then focused mainly on infectious diseases, because this was just really 30 years since the flu pandemic, the Spanish flu pandemic. And so that was really in the forefront of people's minds. And so the initial priorities of WHO were, as it says there, malaria, tuberculosis, venereal diseases, as we called them then, but also maternal child health, sanitary engineering and nutrition. And the initial budget for WHO was $5 million for 1 year. Nowadays, we have 194 member states, 6 regional offices and 150 country offices, over 7,000 staff, and our proposed budget for the current biennium is around $2 billion. We don't have that money, but that's what we would like to spend in the biennium of 2018-19. So that's how we divide up the world into a number of regions. We have big regional offices in each of those 6 regions, and they sort of coordinate the activities that happen in our country offices. So one of our founding objectives has been the management and control of international spread of diseases. And the mechanism that we use now to do that is called the International Health Regulations. And these have been around since the 1950s. And initially they affected or were concerned with infectious diseases. And the biggies were always smallpox, plague, cholera. And then in 2005, the current version of the International Health Regulations, they cover all threats of global public health. So not just infectious diseases, but also chemical, radionuclear events. So this requires a country to have the capacity to detect these events. We call them public health emergencies of international concern, or FAKES. It also obliges countries to report any of these if they happen inside their countries, and should WHO request information on a possible fake in a country, they're supposed to provide answers within a fairly prompt period of time. And so what will happen sometimes is that you'll have country X will contact WHO and say, okay, we've had people coming over the border from country Y, and we think they've got cholera or whatever. can you let us know what's going on? And so we will approach country Y and say, okay, can you let us know what's going on? And it also enables WHO to then make temporary recommendations. But the whole point of it is not to have too much of an unnecessary obstruction of travel and trade. So as we've heard, emerging pathogens mostly have been of a zoonotic origin, and many of these are emerging from wildlife. And really this is only going to increase as human populations increase. We have people moving into areas where humans haven't existed before, clearing forests, farmlands, roads, etc. The mining industry in many developing countries is the initial cause of movement of lots of people into previously uninhabited areas. But as we've also heard, climate change is potentially another cause of the mass movement of humans. And civil disruption is also another factor that we're having to deal with. And so it makes sense for those interested in human diseases to look at what's going on in the environment. And this leads to the notion of the One Health concept. And to my way of thinking, it's a way of thinking about health, but it's not an objective in itself. So you don't, if you've got a particular activity or a particular project that you're thinking of, you don't try and fit it into a One Health approach if it really isn't going to. But it clearly makes sense that you try and see what is the best approach that takes into account all of the potential causes of impact on human health. So it's applicable to the international organisations that are here today. It's also of interest to the donor partners, development partners, non-governmental organisations, and it's a way for national governments and international other entities to look at how they can best approach this. So FAO and OIE and WHO, we already have quite a number of collaborations. The big ones often centre around influenza. We have the OFFLU program that FAO and OIE run, and WHO is a partner in that. And WHO also has its global influenza surveillance and response system, and FAO and OIE are certainly aware of that. Antimicrobial resistance is an area of increasing concern globally as a public health really priority, and it's becoming almost to the point where we call it a public health emergency. And the use of antimicrobials in animals and other systems is really an area that needs close looking at, and how can we bring that under control, so to start to address the issue of antimicrobial resistance. And as I've also mentioned, the IHR requires countries to have the capacity to detect events, while OIE also has their PVS pathway, and you may hear some more about that. And the approach is different, but the goals are essentially the same, so better monitoring of human and animal health. And we've had a number of areas of impact of closer collaboration. My area of interest is in the laboratory, the public health laboratory, and we've had a number of projects where we've worked with FAO and or OIE to develop, to strengthen those capacities at country level. So we had the Identify project, which was a large USAID funded project where FAO, OIE and WHO worked collaboratively to build that capacity to detect priority known diseases, so that if an emerging or a new pathogen appeared, we would have already ruled out accurately and reliably and quickly the existing things, and so what we're left with is something new. Simulation exercises where you actually test the capacities of the laboratory system is something else that we've worked on with some countries. And also we're currently developing a global laboratory leadership project, and FAO and OIE are involved in that project as well, to train people who work in laboratories to be more efficient in the way they use their resources, organise their facilities, and in general improve the quality of the results that's coming out of their laboratories. So to look specifically at climate change, this is again becoming an important issue for WHO, and we know that changes in climate can have really significant impacts on the determinants of health. And so we're looking at things like clean air, safe drinking water, and secure access to a safe food supply and shelter. And quite a lot of modelling has been done and research, and it is estimated that there will be quite a significant death toll as a result of changes in climate over the coming decades. And we're not talking just about lives, but we're also talking about money and the impact that this has on the health budget that countries have. And in many developing countries, there really isn't much in the way of health budget that can be used to mitigate these areas. And so most of the countries that have these weak health infrastructures, they're developing countries, and they're going to be the ones least able to cope. And there are a number of issues here about reducing emissions of greenhouse gases, improving transport, the way food is produced, where it's consumed, and these can be looked at to reduce the impact of climate change to extent. I mean, do we really need to import water from halfway around the world to have with our dinner? Is it something that is really absolutely essential? And there's, just to put it in sort of a visual expression, that there are many particular impacts that will be that we face from climate change. And so just to go into a little bit more about these, I mean, the areas that we're looking at there are things like extreme heat, and we know that this has a direct effect on those, particularly the very young and the very old, and these can lead to a lot of increased mortality with cardiovascular and respiratory diseases. And the higher temperatures, we will get increased levels of ozones and other pollutants, again, that exacerbate people with cardiovascular and respiratory diseases. And then even things like allergens and pollen, we were expecting to see some sort of increases in those. And when you've got around 300 million people globally who have asthma, that's actually quite a big deal. And then, as has already been mentioned, things like natural disasters and rainfall, rising sea levels, increasing variability in rainfall patterns, which can have an impact on fresh water supplies. Too much rain, you can get contaminated water supplies. Not enough rain, obviously, challenges in just accessing clean drinking water. And we run the risk there of increasing diarrheal diseases, and this is, again, a major cause of death amongst particularly young children. And then even looking at things like floods and extreme precipitation, and we're looking at the increasing spread of waterborne diseases, and also vectors that are responsible for a number of major viral infections. So patterns of infection, climate conditions strongly affect waterborne diseases transmitted through insects, snails and cold-blooded animals. And malaria is the one that is of particular significance now. It was already killing 400,000 people a year, again, mainly children and mainly in Africa. But we're also looking at the risk of other vector-borne diseases, dengue, chikungunya, Zika, potentially yellow fever, and climate change is a big issue, particularly in China, where they have a number of trematodal diseases, schistosomiasis, which are spread by a number of different species of snails. So again, this is some modelling from a few years ago on where the increases in mortality are likely to occur. And as you can see, it's mostly in Central and Sub-Saharan Africa and places in South Asia. So again, it's those countries or those areas where the public health infrastructure is at its weakest, and their ability to cope with a significant change like this is severely limited. So in 2015, the WHO Executive Board, this is one of our main governing bodies, endorsed a plan on climate change. And the plan aims to support health systems in countries, and particularly it's obviously of interest in the low and middle income countries and in the small island states, which have the most vulnerable health systems, to actually really understand what's going on in their countries. There are many situations where really they don't, no one knows what the impact is being. The ministries of health really don't have the resources to investigate and to be able to understand what's going on, because at least if you understand, then you can plan. And so the design or the aim of the policies are to help those countries to get an understanding of what's going on, and then to develop some strategies for actions. And so the approaches that we're taking is to sort of building partnerships with the other UN entities, and also with governments, with civil society, with NGOs, and to raise awareness. And really, if you're not out there waving the flag and banging the drum, people start to forget, because it's a long-term problem. It's not something that's going to necessarily have a big impact this afternoon or tomorrow morning, but that over time this is really going to have a major impact on health within the countries. And so we really need to promote that awareness raising. And then also to promote the science and the evidence base, which enables decisions to be made based on policy, or to develop policy that's based on sound evidence. And so that means coordinating with the scientific community and to come up with a research agenda that can help answer these questions specifically from a health perspective. And then you want to support the implementation of the response. And so that's to work with countries and to help them to reduce their vulnerability and to promote health at the same time as reducing carbon emissions. And so this is a challenge that many of the developing countries face, in that they want to industrialise, they want to improve the living standards of their populations, and that's not something that's going to be carbon neutral in the way things are being done now. So we need to strike a balance between what can we do to continue to improve the lives of people in these countries, while also at the same time taking steps to remove or to reduce carbon emissions. And so this is just a couple of slides on some of the initiatives that are in place now. And one of these is the Global Framework for Climate Services Adaptation Program in Africa. And this is working with a number of countries, principally Tanzania, Malawi, and also Ethiopia, which is being implemented by a number of UN organisations and some NGOs with the support of, I think it's mainly the Norwegian government. And that's one that's it's designed to strengthen the capacity of the country, the authorities within the country, to get an understanding of what's actually going on in their countries, to again get that knowledge base, that information base, which can then lead to policy decisions which will serve the interests of the community. And another one is protecting health from climate change. This is a 7-country initiative done in the WHO Eastern Mediterranean region, mostly in the countries of the former Soviet Union. And again, this is to strengthen health systems to take into effect, or to look at the impact of climate change and what are the best approaches to respond to it. And there are a number of activities that are listed there. I won't read them out. But the end result is to see how can we strengthen the health systems, improving things like water, air quality, energy efficiency, making hospitals safer, and generally improving the health facilities in the country. And again, there's another little graphic that just highlights this is part of the communication strategy of WHO for communicating with the general public, just to sort of promote some of the ideas, the overarching ideas that can be put in place to help to address this problem and make a long-term solution, or not even solution, but a long-term approach to mitigating the impacts of climate change as we're going ahead. That's all. Thank you.